Are you tired of being tired? Do's and don'ts of sleep apnea and CPAP. Hi there. Thank you for tuning in and for sending your questions. I'm Dr. Clelia Lima, nurse practitioner with a passion for wellness. Our topic today will help you better understand why you're feeling tired. And at the end, I will share some surprise information if you travel by plane. So bear with me because you're going to be excited to know about this last information I'm going to give you today. So if you're feeling tired, it can be due to many reasons. But today we're going to talk about adults feeling tired due to untreated sleep apnea. How important is your sleep? Sleep is essential for our lives, for everything. It helps to keep you healthy, you know, your heart, your brain, your lungs, metabolism, immune system, mental health, and goes on and on. Sleep has to do with every aspect of your wellness in your health. So if you are sleeping 7 to 8 hours per night, but you wake up feeling tired, in the morning it's like you didn't sleep well. It's not, you are not refreshed. And during the day, you feel sleepy. So I'm gonna give you a few questions and then you're gonna answer for yourself like, is it yes or no for me? Okay. Do you snore loudly? Do you gasp for air when you're sleeping? Are you obese? Do you have a BMI over 30? Do you have a large neck? If you're a man with a collar more than 17 inches, or for a woman more than 16 inches, is considered a large neck. Do you wake up with a headache? Do you feel irritated? Do you have low energy level? Is it difficult for you to concentrate and to focus? Do you go to the bathroom more than twice during the night? Do you have a low sex drive or sexual dysfunction? Do you take medication for high blood pressure, heart disease, diabetes? Well, if you answered yes to a couple of those questions, you need to be checked for sleep apnea. So obstructive sleep apnea affect over 25 million adult Americans. Do you believe this is an increase of 10 millions from 10 years ago? No wonder, because we know the obesity has increased, exponentially in the last 10 years as well. So obesity is one of the hallmark of sleep apnea. So it's a lot, right? When you think about 25 million, you know, adults in the US. But the sad part about it is 85% of people with sleep apnea go undiagnosed. Right now, out there, we have all this large population of people with sleep apnea. They are not diagnosed. So today we're going to help a little bit, because if you listen to this talk and you find yourself in a high risk, you might want to check. You want to make sure that you don't miss, this important treatment. But, the first question that I got is, what is sleep apnea, right? So basically, we're going to call sleep apnea for the sake of this talk, but we're talking about obstructive sleep apnea. There are other kinds of apnea, but we're not going to get into all the technical terms and all the scientific, details. But we're going to talk about obstructive sleep apnea. So when I say sleep apnea, that's what I'm referring to. So basically, you have sleep apnea when you stop breathing for more than 10 seconds, more than 5 times per hour. So if you think about, the hour having 60 minutes, if you stop breathing 5 times, or maybe 10 times or 20 times, we're going to talk about, the different classifications. It's quite significant, right? Besides stop breathing for more than 10 seconds, that also causes your oxygenation level to drop. We call the hypoxemia, right? So the cause of sleep apnea is very complex and can be, so many different causes for different people. But basically, when you sleep, the upper airway muscles and the soft tissues, they relax. We just lay down, gravity kicks in and they are relaxed. It's normal. But when you have a sleep apnea, your soft tissues and your upper airway muscles, they collapse either completely or partially, and that obstruct the passage of the air. So this narrow passage gets, the air trapped, and you try to breathe in and it's obstructed. That's why it's called obstructive sleep apnea. So usually people snore, and if you remember, we had a talk exclusive about snoring, because this is the sound that makes on this narrow passage. And usually people have, this sound like gasping for air, like choking. It's just, very scary when you see somebody stop breathing when they sleep. So the intermittent uh, blockage of air, the intermittent, uh, difficulty of the air going in and out, it causes the brain to kick in. Because basically what happened is, you sleeping, you have the sleep apnea, you there, you are choking, the air is not coming in. The body is very smart. So in order to make sure that you don't die, the brain receives the signal that you are choking, you're missing air. So the brain receives that signal and brings in all these catecholamines, which are kind of chemicals that put a strain in your heart and then makes you breathe again. So it's an effort that goes on and on and on every time that you stop breathing. Otherwise, you die, right? Because if it's obstructed and you don't breathe again, you're done. So all this, dysfunction going on time after time when you're sleeping, that it puts you at high risk for heart attacks, strokes, and all kinds of cardiovascular disease. So it's very important that you are aware of the high risk and be checked if that's your case. So basically, our nervous system, the sympathetic nervous system, gets all this, messages and make sure that it, adapt. If something is going wrong, try to make it better. But there is a limit on how much the body can adapt to all this insult when you have something dysfunctional. So, and that's the main reason that many people with sleep apnea that is not treated, they wake up tired. Because if you see the sleep study of a person with sleep apnea, you see all the sleep stages, and you see how many times the brain is awake during the night. So sometimes you wake up and go to the bathroom, not because you need to pee, but because you just woke up, and this whole process make you produce more urine too, and then you pee. But actually your brain is just waking up, your sleep is interrupted. So this disruption in your sleep makes you tired. When you wake up in the morning, you slept 7 8 hours, but you're tired, you just so unrefreshed. It's because you've been waking up your brain time after time after time, and you don't realize that you're awake, but actually that's what is happening. So how do you know that you have sleep apnea? The way to know and diagnose sleep apnea is doing a sleep study. And two main way to do a sleep study is one is going to a sleep lab for overnight study. There you have, all the electrodes in your head and your chest, and we measure your oxygenation, your stages of sleep, and how many times you stop breathing, and your leg movement, and several information you can take from a sleep study. It's called polysomnogram. The other option is to have the sleep study at home. The home sleep test is effective to diagnose sleep apnea, but it's more limited on the information that you can get. If you have other sleep disorders like parasomnias, REM behavior disorder, narcolepsy, you cannot diagnose with a home sleep study. Also, if you are morbid obese, sleep study at home is not effective. Congestive heart failure, pulmonary disease, neuromuscular disease, those more complicated comorbidities, you cannot have a home sleep study. But for some people it's effective, the home sleep study, and you can be diagnosed with that as well. The way to choose one or the other will depend on your comfort level or doing a study by yourself at home. Depends on your comorbidities, as we just described. It depends on your insurance. The finances, play a part in this as well. The home sleep study is more cost effective. So, you're going to discuss with your doctor or the sleep specialist to decide which one is more appropriate for you. So you have the sleep study, and then you have the result. And then you want to know, how is my sleep apnea? Is it mild? Is it moderate? Is it severe? Those are the classifications. If you stop breathing more than 5 times per hour, you already have a diagnosis of sleep apnea. So basically from 5 to 14, you have a mild sleep apnea. If you start breathing 15 to 20 times per hour, is a moderate sleep apnea. And if you stop breathing more than 30 times per hour, that's considered a severe sleep apnea. And then goes together how much your oxygenation level goes down, how long is the period of stop breathing, and then our evaluation, it will be done according to all those numbers that sometimes you don't understand and don't have to understand, because that's our job to help you to understand how severe your sleep apnea is. So can you imagine, stop breathing 30 times per hour? It's pretty much every 2 minutes you would stop breathing. How can you have a good sleep if you stop breathing, every 2 minutes? And I have seen many patients with severe sleep apnea stop breathing 40 times per hour, 50, 60, 80 times per hour. It's just like unbelievable how the quality of life of those people are so poor, because you can barely, stay awake during the day. And then you have all the other health issues that comes together. So it's very important to know and to get the diagnosis and the treatment. So how do I treat my sleep apnea? What are my options? I heard about the CPAP, and people talk so bad about it. It's horrible. It's difficult. You know what? It's difficult if you don't have the right support, the right follow-up, the right way to adjust, to make sure that you get what is right for you. So there are so many different kinds of treatment for sleep apnea, but it's important to say the CPAP is the gold standard, is the first line treatment. When we say CPAP, I'm putting all together here, AutoPAP, BiPAP, depends on your need. You might qualify for a different kind. So the CPAP basically is a continuous positive airway pressure. It's a way to put the pressure and that can open the airways that are collapsing when you're sleeping. So not only, the kind of machine, there are several kinds, but which kind of mask you're going to choose. So basically you have three kinds of mask. You have the full face mask that, get your around your nose and your chin, like this, your mouth. You have the nose mask around the nose only, and you have the nasal pillows. There are two prongs that, goes on your nasal passage, and then gets the pressure there. So between those three styles, you have hundreds of different sizes and different designs that you can find one that is appropriate for you, that you feel comfortable. And just keep in mind, you can change different kinds of masks when you're trying to adjust to a new treatment. And then you find one that you like. And even if you like one, you can always change to, every 3 months, the insurance pay for a new one. So you can change too. So the CPAP is set in a pressure that is the lowest pressure to correct your sleep apnea. So if your pressure is too high, it's harder to adjust because you're going to feel that pressure, more. When you lose weight, most likely we can decrease the pressure. If you are being followed properly, all those things will help you to adjust and to have success on your treatment, okay? So let's say you have tried and there is no way you can adjust to a CPAP. What is the next best thing? Okay. So other options besides the CPAP is an oral appliance. An oral appliance is done by a dentist. It's tailored to your own anatomy. So it's done, specifically for you. It's not a guarantee that it's going to work. And the difficulties is the cost. Insurance, the health insurance usually uh, doesn't cover, and it costs like around $2,000. So if you don't feel the benefit, if you don't like it, whatever, it's $2,000 that you spent. But it is an option, and if you cannot tolerate the CPAP, it's better that than nothing. Okay. Another option is surgery. And actually, surgery, I would say, is the last resort because it's very traumatic. And also, it's not a guarantee that you're going to do the surgery and it's going to be corrected. It takes 6 to 8 weeks to recover. It's very aggressive. It takes off your tonsils, your part of your soft palate, your uvula. It's really comprehensive. And I have seen many patients coming back to my office after the surgery for CPAP again because the surgery was not corrected. So some people do well. It is approved for sleep apnea. There is a big name for that, UPP. There's the uvula palato pharyngoplasty. It's a big name. It's a word with like 20 letters. But you can try if you think that's for you. But personally, I think it's very traumatic. Another option, which is more recent, is the nerve stimulation device. It's an implanted device that you put under your skin in your upper chest, and has wires that connect with the nerve, the hypoglossal nerve that commands your tongue. So it it's approved by FDA. Some people feel benefit, but again, there is no guarantee that this is going to correct your sleep apnea properly. And the cost is really high. It's about $30,000, sometimes more. And I don't know how much your insurance would cover for that. So those are things that you can check it out. But not everybody is a candidate for that as well. So you have to qualify with different kinds of health conditions, or not having health conditions to actually benefit from that. And if you are morbid obese, is one of the no-nos, you don't qualify for that. So there are several options. The most important thing is that you be treated. Whatever works for you is better than nothing, because the sleep apnea can have long-term severe consequences for your health. So do's and don'ts, okay? Do be mindful of your bed partner advice. I have had several patients in my office that are brought by their spouse, okay, or just a bad partner, okay. I cannot live like this any longer. All the loud snoring, and I see him or her stop breathing, and they're sleeping, but I cannot sleep. It looks like they're gonna die. So if your bad partner tells you you stop breathing, that you snore too loud, that they are concerned with you, go check it out. So do mind your bed partner advice. Don't dismiss high risk signs of sleep apnea. And today I gave you quite a few. So if you see that you have, you're falling into some of the categories, go check it out. Okay? Don't dismiss. Do decrease your risk of sleep apnea. And what is the number one risk? Obesity, right? If you are overweight, you can do something about it. Lifestyle modification is one of the main treatment that we recommend for sleep apnea. So maintain your good weight, okay? Do talk to your primary care provider about your concern that you might have sleep apnea. Because, honestly, how many of us go to our primary and they are concerned about our sleep? Some, but not many. So if you are concerned about your possible high risk of sleep apnea, you bring it up to your doctor when you go for the next appointment, or even make an appointment just for that. I promise you, if you bring it up, if you ask for a sleep study, they will order for you. Okay? So do talk to your primary care. And this ones that I'm going to go on now is if you are already diagnosed with sleep apnea and you're trying to adjust to the CPAP, seek help. You can have follow up with your sleep specialist as many times as you need to adjust to the treatment. So don't feel that you are by yourself trying to figure out what to do. Okay, that's one of the main way to have success with the CPAP treatment is to have proper follow-up. If you need to change mask, if you need to change pressure, all of those things are possible to help you to adjust. Okay. um, if you already have your CPAP, change your CPAP every 5 years. Insurance pays for a new CPAP machine every 5 years. Your CPAP machine has to be in good condition, working well. And besides that, every 5 years you have new technology. You may have a CPAP that is smaller, that is quieter, and they have new features. So you want to make sure that you have, what's the best and what's the most updated available. So every 5 years. If you have your CPAP, change your mask every 3 months. Insurance pays for that every 3 months as well. Change your filters every 2 to 4 weeks. Make sure that you wash your mask and your hose every day. And it's very simple. It's not difficult. Just soap and water. Rinse and then put around your shower. When you get back home in the evening, it's going to be dry. You put it on. It's not difficult. And if you use the oral appliance done by a dentist, make sure that you change that appliance every 2 years, because the appliance gets worn out too. And our anatomy change, with time. So every 2 years you get a new one, or sooner, because you might need sooner. The same thing with the machine. You may need a machine sooner than 5 years if it's broken, if it's not working well. So know your rights, right? Another thing that very important that you be proactive, because sometimes the doctor, don't get it, too fine tuned. If you gain or lose more than 20 pounds, you need a new sleep study to make sure that you adjust the pressure in your machine. And some people, they correct the sleep apnea by losing weight. So you might be one of those. But don't be fooled, because some people are not overweight. They are thin people, very thin, very, normal weight, and they have sleep apnea. So, each person is different. You just want to make sure that you know your options, okay? Now, the last one, and that's what I promised you, it's a very interesting one. If you travel by airplane, you're going to be happy to know this one. So it's a don't. Don't leave your CPAP home when you go on vacation. Take your CPAP with you. It's your best friend. But the good news is your CPAP can go with you inside the cabin, okay? When you travel by airplane, the CPAP is a medical device. It doesn't count as your personal item. It doesn't count as a carry-on. You don't have to pay for that. Okay, and now, everywhere you go, you have to pay for all kinds of luggages, right? So your CPAP, you don't have to pay to carry your CPAP with you. And it's free of charge because it's a medical device. So take a CPAP with you, okay? So if you want to visit to assess your risk for sleep apnea, I'll be happy to have a visit for you. And that's my passion because, my doctor research was done in sleep disorders. So I'll be happy to give you a free questionnaire, and we can, help you in your journey to correct your sleep apnea. Okay. So we're gonna end, for now. Please subscribe to my channel, like my videos, and share with your friends, okay? See you next Tuesday for our live Q&A. Keep moving towards your best self. Feel well. Bye.